Hi, my name is Wojtek. This is my osteosarcoma pathophysiology mm, poster presentation. As you can see, my topic is osteosarcoma, and I just thought I'd briefly explain why I chose osteosarcoma. The reason being is going into this project, it's a disease that I knew next to nothing about, minus what we briefly talked about in our pathophysiology class. Um, and I figured it was a good opportunity to learn something and go in depth in a disease. So, getting into it, osteosarcoma is a cancer. It basically forms in osseous tissue. What that means is that you have mesenchymal cells that have a DNA mutation within them, and when they replicate, they produce not a healthy bone matrix, but a malignant bone matrix, which is a tumor, which we call a neoplasm. Um, it's worth noting that osteosarcoma is not correlated to typical cancer risks such as smoking, poor diet, lack of exercise, excessive sun exposure, etc. Um, there is one risk factor that does have to do with kind of typical cancer associations, and that would be having a prior cancer diagnosis that required the use of radiation therapy. The reason being is when you irradiate an area, you're obviously damaging also healthy cells, and there is a statistically significant risk that within 10 years, or rather 10 years after the fact of getting the radiation therapy for a previously cured cancer, you can increase your risk for developing osteosarcoma. So, imaging is typically the first stage in diagnosing this disease. Typically, a patient's going to present with like pain, limping. Um, Typically, these are going to be kids. There's a bimodal age distribution with this disease, so you're going to see it often in adolescence. The reason for that is that um, there's a higher chance of DNA mutation when you have a high rate of replication. That's something we learned about in physics with the law of Burgundy and Tribune. Um, so basically, when you're hitting your growth spurts, your long bones specifically are growing at a fast rate, and when that happens, you have a higher statistical probability of having a mutation occur, which then results in you developing a tumor, which we would call an osteosarcoma in this case. So you have adolescents being the primary victims of this disease, and then you do also see an increase in cases or diagnoses of osteosarcoma in people around age 60 and up. So typically, these kids are going to come in with like a limp or idiopathic pain of some sort, or sometimes they'll have some sort of minor injury that can result in something called a pathological fracture, which is when you sustain injury or trauma rather to your bone, which breaks because it's weakened because you have a tumor there. Um, so you image it with an X-ray. Usually they suspect a fracture and they're going to see something like a neoplasm. Um, it's worth noting osteosarcoma is the leading cause or leading bone cancer in children, so it is something that should be looked for um, as a radiologist, but also as a radiographer, something to keep an eye out for. So if you look at the center picture here, you can see that in the distal femur over here, there is looks kind of like a lucency. What that actually is a neoplasm of osteosarcoma. Um, in this case, it is a 13-year-old male. Um, I don't know what they presented with, but you can see that this is actually an aggressive, or what we would call a high-grade osteosarcoma, based on the fact that the tumor is growing past the epiphyseal plate here and going into the very distal portion of the femur. That's a sign suggesting that it's a high-grade or aggressive osteosarcoma. Um, so typically once a radiologist sees something like this, they're going to refer them immediately to hopefully a high-grade cancer center to begin with, but they're definitely going to be getting MRI if at all feasible. That's the most accurate way to stage and grade um, most cancers, but specifically osteosarcoma, I know for a fact. Um, They could very well likely be getting a PET-CT. That's also good for advanced diagnostics. These kind of like more nuclear medicine tests that we might be less familiar with as radiographers. Um, I know that they use some sort of fluoride. It's like fluoride gadolinium 18 or something, um, and it's a good marker that'll indicate the osteosarcoma neoplasm likes to uptake, and then the way nuclear medicine works is going to radiate from that site of tumor, and it'll show up like you see on the image on your left hand side over here. So these are all good ways that osteosarcoma can be diagnosed, but the gold standard is always going to be a biopsy. So you have two forms of biopsy that can be used. You can either do a percutaneous needle biopsy, which is usually done by a radiologist, or hopefully an oncologist that is experienced in dealing with osteosarcomas. And what that would involve is typically something called CT guided, where the radiologist or the physician is going to go in with the needle into the actual neoplasm, remove a portion of the neoplasm through the needle, then send it over to lab where they can give a definitive or verify that it is indeed osteosarcoma versus any other form of cancer. The other form of biopsy would be what's referred to as an incisional biopsy. And incisional biopsy is where a surgeon specializing in osteo or in oncology and cancer would go in and physically cut into the tumor or diseased area and remove the sample that way. That way tends to be a little bit more risky because if it's done incorrectly, you can actually dislodge the osteosarcoma cells, which would then um, have a high probability of metastasizing, which is something you really want to avoid with this disease because your prognosis goes down significantly. So if we want to look at prognosis here really quick, um, basically your 5-year survival rate with this disease, if there is no metastatic disease, would be about 70%, which is good, not great, but if you do have a metastasis present, then your chances of 5-year survival drops down to about 25%, which is a lot poorer. So best thing for this disease would be early diagnosis and intervention with an aggressive treatment plan, which would include surgical resection as a must, chemotherapy is another must. Um, Using just one or the other isn't going to necessarily take care of this disease. You really have to use both. So chemotherapy, if we want to just talk on that briefly, you have neoadjuvant chemotherapy, which would be chemotherapy done preoperatively. The reason for this is to hopefully shrink this tumor and cause necrosis to occur, which would make it less likely to have those osteosarcoma cells dislodge and cause metastasis, which is the biggest concern here. Um, then you have adjuvant chemotherapy, which would be done post-op, and that is just another way to help reduce the chance of creating a metastasis on accident. Um, so if we want to just take a quick look at our pictures they provided here, these are for a 13-year-old male that was diagnosed with osteosarcoma. On all three pictures or images are all different modalities, and I think it gives a good overall view of how diagnosis can occur with osteosarcoma. So on your left, you have a whole body nuclear medicine scan. You can see the uptake on what looks to be the patient's left distal femur over there. In the center, you have an AP knee radiograph, and you can see correlating to the nuclear medicine scan, the distal femur, you could see that area of concern. And then on the image on the right is actually taken from a T2 fat saturated MRI, and it gives you a good idea of the exact margins of the tumor, which you don't get in the other two photos or images. So in conclusion, this is a deadly cancer. It is the most common bone cancer in children, even though it's relatively rare, but it does affect a lot of young people, which is a reason I feel like it's very worthwhile to invest time and money into researching. I think if we can work on having earlier diagnosis for these patients and working on researching more effective treatment plans, then we can definitely increase quality of life. That would include like sparing more limbs, having less people having to go through more invasive treatment procedures, and it would overall include the quality of life of patients diagnosed with this disease. Um, so early detection is a must, and more effective treatments would be something I would recommend in the future for future research. Thank you so much for taking the time to look over my pathophysiology poster, and I hope you learned something from this.